Good day to all participants. My name is Jutta Marfurt from the Menzies School of Health Research in Darwin, Australia. In the following video, we present how a good quality finger prick blood sample is collected into a microtainer tube. You will be provided with an ACROS lab standard operating procedure document. Therein, all the test procedures are described in great detail. However, something is different to other study procedures you have performed before. We do not do the tests at point of care, meaning doing the tests directly from the patient finger prick. We do all the tests in the lab using the microtainer sample. The following video will show you step by step how to draw a good quality finger prick blood sample into a microtainer tube. Please note at the end of the video, when it comes to the labeling of the tube, it is important that you label the tube with study ID, which is given by the study PI, the date and time.
Ensure that the patient is clearly identified before each puncture. Prior to blood collection, it is recommended that the puncture site is warmed to help increase circulation. Simple heat packs can be used for this. Disinfect according to the guidelines of your institution and wait until the puncture site is dry. The tube cap opens upwards when you press on the ribbed area on the tube. The area marked with an arrow is to indicate the opposite side of the scoop. It is not recommended to touch the scoop while opening the tube. Perform the puncture with a suitable lancet. Position the lancet so that the cut crosses the friction ridges. This technique provides the greatest sample yield. Depending on the test procedure, it may be necessary to wipe off the first drop of blood with a sterile gauze pad. The first drop of blood may interfere with the analysis result due to a high content of tissue fluid. Hold the puncture site in a downward position. This prevents the blood from dripping away. The blood can be easily collected by holding the mini collect tube at an angle. You do not need any other equipment thanks to the integrated scoop. It may be wise to lightly move the tube around or gently tap it on a hard surface to release the droplet from the scoop. Fill the tube with a designated amount of blood to ensure an appropriate mixing ratio of additive to blood. When you have collected the required volume of blood, close the cap again. A clear, audible click means that the tube is properly and completely closed. To immediately stabilize the blood sample, gently invert the mini collect tube 8 to 10 times directly after capillary collection. Stop the bleeding by pressing with a gauze pad. Always follow the applicable guidelines in your institution to identify the patients and label the sample containers.